Good morning, and welcome to the Virginia Interfaith Center for Public Policy's live weekly broadcast. I'm Roberta Oster, the Communications Director. Our show brings you the latest news and resources from policy experts, faith leaders, legislators, and community members. We focus on economic, racial, social, and environmental justice issues here in Virginia. We will keep you up to date and keep our elected officials accountable. We will also share opportunities for you to get involved in our work advancing social justice and helping our neighbors. This is an interactive broadcast. You can ask questions by writing them on Facebook during the show. Today, we have a very special broadcast about workers. The COVID-19 crisis has hit workers especially hard. Workers in poultry plants, grocery stores, hospitals, and other essential businesses are putting their lives at risk every day. Our two guests today are on the front line of this issue, two powerful union leaders here in Virginia. Doris Crouse-Mays, who is the president of the Virginia AFL-CIO, and Dyana Forster, Director of Political and Community Affairs for UFCW Local 400. I am pleased to introduce our moderator, my colleague, Kim Bobo, who is Executive Director of the Virginia Interfaith Center for Public Policy. Kim?
Thank you, Roberta. Good to be here. So, Doris, I want to ask you first, tell us what you're hearing from workers, and do they feel safe going to work right now?
Absolutely not. I mean, here in Virginia, when the virus first started, workers did not have the proper protective equipment at all. As you all know, it was scarce. In addition to that, being tested. And workers are really, really afraid. They want to go to work and they want the state to run, but they also want to be safe. And it's our responsibility to ensure that that happens. They have been on the front line since day one, and they have been our food source. The mail has brought medicine to our homes and everything, and it's up to us and the citizens of Virginia and this administration to ensure that all workers are safe.
So, Dyana, you all represent grocery store workers, poultry workers. Are you hearing the same thing as Doris?
Yeah, I mean, I think our members are proud that they are, working and serving the community. I think a lot of time we think about frontline workers, we're thinking about the police officers and the nurses. Our members are, making sure that people are able to feed their families, and they've been given support and access and recognition, I think, a lot from customers. You have customers coming in. I think you guys also, supported our members by bringing them protective equipment. The challenge has been, though, is that the government has not protected the workers and our members the same way they protected first-hand responders, the nurses and the police officers. I think that now more than ever, we recognize the value of hourly workers because they're keeping our economy going, and we need to protect them as they're out there making a sacrifice to keep us able to feed our families and, maintain whatever level of normalcy that we can. But when they see their coworkers, getting sick, some dying, it's kind of hard to keep the momentum up during these times for our members.
So, Doris, what could Virginia do? Are there things that the governor could do that would really matter here?
Well, absolutely. The governor could put forth, safety regulations and stuff requiring, companies to provide, safety training, have on-the-job training, have free testing, provide free PPE, and most importantly, if workers are afraid and if their workplace is unsafe and it's reported, there should not be any retaliation on a worker who speaks up and says, this is unsafe. And it's not only just for the workers, it's for the community and the customers that they serve. And that is why we have the petition that we have to sign, asking the governor and the administration to put forth these common sense guidelines. And in addition to that, there's a safety and health codes board that could do emergency things, and we call upon them to take action. Now is the time. If people cared about workers in this state, now's the time they need to care, and they need to sign that petition and ask that worker safety is first and foremost.
So, Dyana, do you all agree with that, that we need some sort of regulations and not general suggestions?
Definitely. I mean, you think about when the social distancing came into play, we did not mandate it in our stores. We have companies that, took it upon themselves to do it. But then you also put our members in the position of, policing that and making sure it's enforced, at the same time trying to provide customer service. So there's not support in the stores for them. It has to be a regulation. It has to be across the board so people understand what's expected of them. I think when I think about what we've been able to get across jurisdictions, so our membership extends from Maryland to DC. DC was able to put, the mayor of DC put an executive order in place to protect our members, to make sure they had access to testing before coming on a shift, to make sure there were social distancing guidelines that were followed in the stores. And I think that it makes our members feel that, the government cares about them, and it's not just a customer or someone doing a good deed, but it's actually the expectation. And that's what we need to see from government, is that it's the expectation. It's not, up to one company to put a policy in place. It's not up to our members to enforce. I mean, I think we've seen, altercations where our workers are trying to keep themselves safe. I mean, they have families to go home to. And, one of the benefits of being identified as a first responder for a grocery store worker is they'll get access to childcare. They're making a decision to go to work and to provide, financially for their children, but who's keeping their kids while they're there, right? The schools aren't open, the childcare system's not open, and they're not identified as first responders, so they're not getting access to the childcare. They're going home to kids. I have kids running around my house all day. I can't imagine, working a full shift in that chaotic atmosphere and having to come home to children. So this is why these measures and protections need to be in place. And I'm not just for grocery store workers, but there are people out there, the construction worker, the people that are out there still working during the pandemic, the ones that we don't see, they need the support, of the government to stand up and say, we're going to protect you as you keep our economy going, as you keep the construction going, as you keep, some level of normalcy in our community.
So, Doris, why can there be regulations in DC, but not in Virginia?
Well, that's a very good question, Kim. And actually, it's a question that, it can be. Virginia can pass laws too, just as well as the federal government. And honestly, right now, I would put a little bit more faith in my state government. But at the same time, we can do it. Workers should not have to choose between their life and their health and making a living in this, because workers need to go to work in a safe environment, and everyone has to have that protection, and Virginia and our administration can provide that in making sure all workers in this state have the protections that they need.
So we see a comment from Sheila Stone about home care nurses not always having the PPE they need. How can these industries that are really on the front lines not be providing this kind of PPE? So are you seeing this a lot, Dyana?
Yes, I mean, I think everyone's passing the buck and the level of responsibility to the other, there's no assigned we're saying, especially when these things are recommendations and not requirements, then, people are going to do the bare minimum when something is a recommendation. But the reality is, if we want this pandemic to stop spreading, then we have to make sure the workers on the front lines are protected and not further exposed to it. And, it's in the best interest of the entire community that our members have access to it. But it has to be mandated, and it cannot be. And we have to identify a funding source. Where are we getting it from? We have to make sure that it's required. It cannot just be a good gesture to, provide. We've had several people reach out to us to say, we want to come to your stores and we want to give members, our PPE. We have nurses that reach out to us because they see so many of our members coming in, and, they know the reality of touching food and interacting with, customers, that it's going to continue spreading. So it has to be mandated and required. But, we also, can't just allow one company to do it, one industry to do it. If people are working, they need to have access to PPE. They need to have access to testing. They need all these things to make sure that they're safe, our community safe, and we don't continue spreading this. I think I've been a part of these reopening task force, and we're looking at these things from a very, business and get the economy going. But if we have a sick workforce, if people don't feel confident in shopping and, getting back to some level of normalcy, then it doesn't make a difference how fast we reopen these cities.
So really, if we're going to reopen, we have to have some requirements around protecting workers as part of this. So Doris, in the letter, the petition that you're asking people to sign, you also mentioned something about workers' compensation and trying to make a presumption that around workers getting sick in the workplace. Could you explain that to us?
Yeah, and one of the things I think too that has brought to light with this pandemic is just how weak, honestly, that Virginia's laws are when it pertains to workers. Virginia's workers' compensation, we're like on the bottom. And it's really, Virginia has one of the most restrictive restrictions for workers to even obtain workers' compensation. But so we need to look at that and change that. If it's reopened, they're at work, they get the virus, it should be, an assumption that they got it there and to be covered. There's this move about that workers should go to work. We need to cut them off of their unemployment. They need to go back. The company tells them they have to go back. If they don't go back, then what recourse do they have? If they go back, get sick, then what do? They can't file workers' compensation because it's not covered. And then what about the quarantine? What about paid leave for workers? Instead, there they are. And they're going to have to choose. And now there's even a move for, like, if a worker was to get the virus by going back and everything, and they can't get workers' comp, then the employer doesn't even want to have any liability. So what I am seeing, and this is the most frustrating and disgusting thing, workers are not a commodity. And it's being portrayed that that's what we are, that we're a commodity. You can just do with us whatever you want to do without any recourse. And now is the time that workers will stand up, and we're saying no. We're saying sign the petition, have the administration and our state protect us, protect the workers. It is time that workers in this state were number one, not on the bottom.
So we have a question from Destiny, who wants to know, what can the average worker or average Virginian do about this? What can we do to help?
Well, one of the things they can do is sign that petition.
Well, there you go. All right. So if you haven't signed that petition, you can see the link.
Right.
Go ahead and click on the link, sign that petition. But what about, I saw that the governor was recommending that people wear masks when they go into stores. Dyana, what do you think about that?
So we in our store, we in DC and Maryland, they're required to wear masks. I think,
but we're not required in Virginia.
Right. So I do think that it's interesting, especially when you have a governor who's a physician. So I think that, one, as a Virginian, wearing a mask while you're shopping, being mindful of the social distancing, making sure that you're staying 6 feet away from our members in the stores. But I think more importantly, like I said, individuals can do these things, but if it's not requirement, if it's not an expectation, then it's not going to be, it's a one little effort. So I would say call your delegate, call your senator, let them know that, you feel uncomfortable going to the grocery stores, you feel uncomfortable, in the community with, these things not being a requirement or something that they're practicing. So it don't just, bring the PPE into the stores to our members, make sure elected officials know that this is their responsibility to do it.
So we have a question from Keisha asking, do we think these regulations should be across the board? Should they be
Absolutely
for all sectors or just a few? So Doris, help us with that.
Yeah, it has to be with everybody. I mean, you also have, the correctional officers, you have, toll centers, you have call centers. It's every worker in this state, regardless of their job. These regulations should apply to everyone, not just, one. It's everyone. We're all in this together. We're all workers, and all of us need to make sure that we're safe.
So, Doris, I thought that normally regulations took like 18 months or something to develop, but I gather there's some emergency regulations that can be offered, and who would do that? Who would offer those regulations?
So that would come about that Safety and Health Code Board that the state has. They have the ability to put in place emergency regulations, and the administration can work and do that. But that really needs to be done. If this is not an emergency, I don't know what is. And it is time that we do that. The administration can make sure that the Safety and Health Codes Board really put forth these emergency regulations and regulations for everybody, not just one person or one job classification.
So, Dyana, let me ask you this question from listener Jeanette Amato. Will these regulations apply to undocumented workers?
Definitely. I mean, I think that they're more vulnerable right now because, the language barrier. I was in a store, I think one store that I was in, I had to explain to a Spanish speaker that he had to wear a face covering because he didn't know. So I think, it definitely should apply to, like we say, all workers. But I don't think it's about mandating that they do this. It's mandating that the state put these regulations in place and provide the equipment, PPE and overall how to use it, how to be safe at work, right? This is our new norm. And instead of thinking about how fast we get back to things as usual, we're not. So let's start, slowing down. I think we saw this even with the school system. They immediately want to start the distant learning and have children, sitting in front of computers all day. They've never been on conference calls like us or never participated in Zoom. We didn't slow down to say, like, look, this is the new reality of where we are. These are the things that we're going to do we're going to learn through this together. We're going to take new steps together instead of reacting so quickly and putting us all at harm's risk. So, this is the new reality. So therefore, we need to make sure that these are requirements that each company that's opening doors understands, the same as they do wage and hour laws. These are new health and safety laws. This is not a punishment. This is protecting us all and keeping us safe.
So our listener just raised the point that we have a governor who's a doctor and should understand the importance of these kinds of regulations. So again, tell us about that petition, Doris, that people can sign.
Well, the petition, we want the administration and the governor to know that workers, there are things he can put in place for protection for workers. They're common sense. Things, and he should do it. You're right. He's a doctor, so he should know about preventative medicine. These things are preventative to prevent workers and the community and the customers from getting the virus. So just look at it as preventative care, preventing the workers and the communities from getting sick. So it's real simple. Just do it.
So we had a question a minute ago from a listener about whether this might affect decisions made in the General Assembly around worker issues. And I understand there was a bill to get paid sick days that, in fact, the Virginia Interfaith Center helped champion. That was not passed in the General Assembly, a very modest proposal. Doris, do you think that's going to change in the upcoming General Assembly? Do you think that we might see things like paid sick days get passed or other health and safety protections get passed?
I have faith that will happen now. And if this pandemic don't get people to understand that, then shame on them. And if they don't want to do it, we just need to elect somebody that's going to do it for workers. It's so unbelievable that we did not get paid leave this last time. And we need to get it, and it needs to be done as soon as possible for workers. So.
Well, and I understand that in the increase in the minimum wage, which was a good thing, and I know the AFL-CIO and UFCW were out there helping fight on that one, that farm workers were continue to be exempt from the minimum wage. And I guess, don't we consider farm workers essential workers right now? Dyana, what do you think about that?
Yes, let's also talk about tip workers, right? Restaurant workers also being excluded from the minimum wage. And once again, I think it's disgusting that when we decide to make cuts, the first place we cut are from workers. But like I said, they're the ones that are keeping our economy going. And, this is where we decide to, trim our budgets, right? But and nationally we're hearing paid sick leave. And when I think about it, it's like, how many times have we said, as a labor movement, protecting workers, that when workers go to work sick, that then the consumer gets sick. And it's now common sense, things that we've been fighting for a very long time. But you talk about, the poultry worker, people that are, part of the food supply chain. And these are people that are, making very, the minimum and putting their lives at risk to go to work every day. And this is how we treat them. So, I think that this is a wake-up call. I think this exposes, the injustice in the treatment of hourly workers.
So, Doris, I want you to take this question from listener Adam Sachs. Are there any legal protections for workers who are fired for refusing to going to work immediately after reopening? If they feel like they're not, they're not going to be safe, can people not go back to work?
Well, they can choose not to go back to work, but unfortunately, there's not enough legal protections in the state of Virginia for workers in protecting them on that. Now, one of the things, though, that workers need to realize is if they've been on unemployment and they've been called back and they refuse to go back because it's unsafe, they just need to make sure that if they're cut off of the unemployment benefits, that they go through the process, the adjudication, to at least get their unemployment benefits reinstated. But unfortunately, Virginia doesn't have a lot of legal protections for workers. But at the same time, if this happens, we would encourage workers to reach out to, the Virginia AFL-CIO and others that could help assist workers in making sure that they get the protection that they need. But there's not like one legal law that we can all point to say that they have all this protection because of fear of retaliation. So,
but again, if Virginia were to pass emergency regulations, people could feel safer about going back to work, and it feels like there'd be a lot more support for opening up among workers if they felt like they would be safe and protected, which is why we need listeners to sign this petition calling on the governor and this Health and Safety Codes Board to issue emergency regulations. So I've heard three things that we could do in Virginia that would really matter. One, we could offer emergency regulations requiring employers to protect workers. Number two, we could make it not just a suggestion, but a requirement that customers and patrons of businesses that we wear masks when we go in, that would really matter. And thirdly, Doris, I heard you talking that we needed to change our workers' comp laws. And again, there's probably some emergency changes that could be made there as well. I'm not sure our listeners all really know what workers' compensation is. Could you just quickly explain what is workers' comp and why does it need to be changed in this COVID moment?
Well, in Virginia with workers' compensation, I said earlier, it's one of the most restrictive of any state we have in Virginia. So if a worker's at work and they get injured or hurt or anything, they have to say exactly the moment that they were injured or hurt before they get workers' compensation, because you have to prove what happened and when it happened. So that's like the first hurdle. But then, the benefits is it's not like you get all of your pay if you're out sick. It's only a proportion. And then you have to go to doctors. And these are not like a doctor that would be my normal physician that knows me better than any other doctor. You have to go to doctors that are provided, with the employer and the workers' comp. You're going to people that you don't even know and they don't know you. And everyone heals differently. Everyone reacts differently to injuries and medication. But these laws, again, it goes through the General Assembly as well. So people, even in elections, really need to know that their legislator really holds a lot of power in terms of their everyday living and working and everything. And they really need to pay attention and really promote people that have their back and not just the back of others. So that's one key thing.
Yeah. So Dyana, Sheila is reminding us that it's really not just masks, right, that it's a whole variety of things. Could you talk about some of the things that your union is recommending with employers, whether it's grocery stores or poultry plants? What are some of the additional recommendations that you all have offered?
Well, what we've asked for is that the same requirement, the public requirements, right, of, social distancing, making sure that those requirements are mandated in the stores, making sure that there's a max number of people that can be in the store to, to maintain the 6 feet distance, but also making sure there's testing, that our members are tested before coming to work, making sure that when someone does test positive for it, that they are allowed to take off of work, and get the paid time off. We know that it takes 14 days, so people need to be paid for those 14 days. We know that there are other things that, the state and the government has, and the country has said, these are the things that are going to keep us from spreading this disease, common sense things. So we need to require that those things are happening within our stores. When our members, we have someone who is sick or test positive, then the immediate workforce should be notified and should have access to testing. We have the distancing requirements, the testing requirements. We have a list of demands. You can go to UFCW Local 400, our Facebook. We have a list of things that we've been able to get in other jurisdictions, in DC, and some in Maryland. But, I think, we need to make sure that whatever regulations that the country is saying, these are the way that we keep, our community safe and healthy, that those things are actually requirements in stores when you go shopping.
So Dyana, we have a question about Kroger and the requesting hero back pay from workers. Can you explain some of that to us?
Yeah, so we have a number of workers that were sick and tested positive, and not, so when you take off, you're not getting that 2 weeks paid sick leave. And there are people now. Imagine if you are a senior that's working in a store and that you have pre-existing conditions, so you now have to make a hard decision. Do I go to work and keep my job? Or do I say, I know that I'm vulnerable to this disease and it could be life or death for me? And we want our members to be able to make those decisions, right? We want them to be able to say that, I'm not healthy. I have pre-existing conditions and I don't want to work. So it should be a choice. And if they, they shouldn't lose their jobs. They should get, the same pay. I've seen companies, make working they offer the work to the current workforce and they still pay the workers that don't want to work, but the ones that are working get paid double. So it's, it's a benefit. But, I think that instead of penalizing, instead of putting this responsibility on our workers, all workers that are working through this pandemic, it's our responsibility to stand up and fight for them. Let's be clear, the things that we've won, that the unions have won for grocery store workers, non-union workers have benefited from. We've been the voice advocating for, on the national level, paid sick leave, PPE, all of the things, back pay. We've been the ones advocating for all workers to have access to these things.
Well, we're about out of time, so I just want to ask again to both of you, and I'll start with you, Doris. Okay, what can we do? Tell us what people in Virginia can do to try to improve conditions for workers during this pandemic.
So again, start out with signing the petition, of course. Also, reaching out to your representative as well. Also, just, really protect each other as well. But if you fear everything is unsafe, the state has, the Department of Labor and Industry, so workers should call there as well. But the most important thing is we have got to have the administration to put in place regulations that are going to protect all of the workers in this state. And I will just end by saying this, and I mentioned it before, workers are not a commodity. We should not be treated as a commodity. And here we are on our Memorial Day weekend, and when, we've got the new normal, and I do ask that we honor our military for everything that they've done. I think we should also honor all of the workers in this state, not just in this state, but all across the country that have had the virus and the ones that have died because of this virus. And we also need to honor all of the workers who have been on the front line, no matter what they've been doing to help our communities. It is time that we honor them as well. And the best way to do that is to sign that petition, because we need regulations, not just suggestions.
Thank you, Doris. That you couldn't have said that better. Dyana, it's going to be tough to follow that. Go ahead.
I will say, one, just to pause for a second and, think about the human element of this. I remember the first day of the pandemic, I was in the grocery store and I was like, what is going on? It's 6 o'clock in the morning and I was getting flowers for my daughter's birthday. And everybody was in the panic mode, like the snow, Armageddon's coming, and I didn't know what was going on. And our members were being, yelled at. People were being impatient. So I would say, one, as the human element, just put yourself in the shoes of the worker that's standing behind the cash register that has seen maybe a coworker pass away and leaves their children at home to come to work every day. Until the government regulates social distancing practices, until the government mandates and supplies PPE supplies, that we do take the responsibility to do that ourselves as good citizens, as good consumers. Our members, the workers, are really putting their lives on the front line right now.
Right.
There are people that want to work every day. And my sister's a nurse with 2 kids. And, it's hard. We joke about it like, hey, you better come back because I ain't keeping these kids all night. But we're also praying at the same time. Some of us have, the luxury right now to work from home and to keep work going. But remember the ones that don't. Remember the farm worker. Remember the poultry worker. Remember the construction worker. Remember the grocery store worker. And we have a responsibility, as a citizen, as a human being, to be respectful and patient in this time. But we also, to go back to what Doris says, we have to advocate for them. We have to let the elected officials know that, election's right around the corner. We're watching you. This is your opportunity to stand up, to do what you were elected to do, to regulate. We don't need recommendations. We didn't elect anyone to give us recommendations. We elected you to put legislations, to put measures in place to protect our workers, to protect us. So, I think, like I said, we ourselves can advocate. We can go into the store and be good citizens, be patient with each other during this time. But at the end of the day, we're not going back to the norm. And things have got to change. We need paid sick leave, common sense. When people go to work sick, then they spread the disease and they get other people sick. So we have to make sure that we don't forget where we are now. And these hourly workers are fighting every day to make sure that we can provide for our families and put that meal on the table.
Awesome. Well, I've been reading what a lot of the Virginia's faith leaders have been saying about why they're choosing not to reopen congregations right now. And it all comes back to love of neighbor, right? That we we have to care for those around us. And nothing is more important right now as we think about reopening than trying to make sure that we're protecting these frontline workers. So Doris and Dyana, I am just so grateful for the work you're doing. Thank you to the listeners. Please, if you haven't signed that petition, sign it and then pass it on to all your friends, because we want our government, our Virginia government, to establish regulations, real requirements, and not just suggestions. There's more we can do, and thank you to the two of you for all you do. And God bless, and everyone stay safe this holiday weekend, and also pray for and be thankful for these essential workers.
Exactly. Yes.
Thank you.
Amen. So, thank you.